Tonight we've learned future control of the Hennepin County Medical Center will likely be decided in the next week.
A public hearing tomorrow and county board vote will decide who controls the state's largest hospital. Tom Hauser is live in Minneapolis to tell us why this is a sign of the times in healthcare.
Yeah, Lindsay, most of us have heard the phrase uncompensated health care. That's when people show up at hospitals like HCMC and have no insurance but still need to be cared for. It is at the core of the financial hole this hospital finds itself in. Hennepin County Medical Center's financial problems related to uncompensated care are magnified to the point the hospital lost money 7 of the last 8 years. This year, the imbalance could hit $36 million.
We are facing structural financial crisis at this hospital because we take care of patients that don't have insurance or are underinsured.
Mohammed Omar is chairman of the board of HCMC's parent, Hennepin Healthcare. He opposes a proposal by the Hennepin County Board to dissolve the Hennepin Healthcare Board and take back direct control of the hospital.
This hospital is not because it's in trouble because of mismanagement. When you take care of patients, regardless of their ability to pay, that is what happens.
The Board of Commissioners knows that we need to step in, and we need to step in directly.
Hennepin County Commissioner Jeff Lundy supports dissolving the Hennepin Healthcare Board because the crisis has grown too large. Nobody's being accused of any wrongdoing here. Has the scope of the problem just outgrown their ability to handle it?
Yep. As they've said, they have no ability to raise taxes or to reallocate revenue. The county board does.
They say that these financial problems are beyond the ability of a volunteer board to deal with. How do you respond to that?
I put my resume next to anyone. I can tell you I have more experience than all of them combined on financial matters. So I think that is a cheap shot.
Lundy says this isn't about politics. It's about saving the hospital. Have people already made up their minds, or are you going to wait and hear people out on Tuesday?
Yeah, I don't ever speak for my fellow commissioners. I think, there are votes to move this forward, but I think people want to hear, are there things that we may want to modify our motion? Are there things that we might want to take into consideration as we do this?
Now, the future of HCMC impacts people all around the state because of its Level 1 trauma center and its burn unit. It would take 5 of 7 Hennepin County board members to vote to dissolve the Hennepin Healthcare Board in order for that to happen. Again, that vote is expected a week from tomorrow. If it does happen, then the Hennepin County Board will either way has to decide whether or not to raise taxes to save the hospital. Live in Minneapolis, Tom Hauser, 5 Eyewitness News.